Back, it's time now to answer some of your medical questions, and joining us to answer them is News Channel 5's medical specialist, Dr. David Soria. He's the Chief of Emergency Medicine at Wellington Regional Medical Center. Thanks, as always, for stopping by.
My pleasure. Good to see you.
Good to see you. Our first question for you today: what is the difference between a kidney stone and a gallstone? Oh, good question.
Yeah, it is, and really they're two entirely different things. The only real similarity is that they both cause severe pain. Matter of fact, it's interesting because a lot of patients will come in and they'll say it feels like they're having a baby, and interestingly, most of the time it's from men. Why these guys think they know anything about that, I don't know, but at least they can appreciate the pain, right? Nonetheless.
I don't mean to laugh at their
Yeah,
pain,
that's all right.
Gallstones
occur in the gallbladder. It's more up here in the right upper quadrant, and it's a severe pain. Comes on right away. It goes into the back, and it can cause nausea, vomiting, and that's mostly from cholesterol stones. The way you treat that is typically going to be from surgery. Unlike with kidney stones form in the kidney, and you feel the pain in your back. It can go into the groin.
Wow.
And those stones are going to be mostly uric acid or even from calcium or magnesium.
Okay.
And most of the time the treatment for those is nothing. They pass on their own, but sometimes a urologist has to put in a stent.
Gotcha.
Painful, but not very serious.
Okay. All right. Good explanation. Our next question for you comes from a viewer who says, I wake up in the middle of the night with a dry mouth. What's causing that, and how do you stop it from happening? Yeah,
dry mouth can be caused or can be a symptom of a lot of different things. Typically more systemic processes like rheumatoid arthritis, diabetes, a problem with your salivary glands, or more commonly, medications that you use that can cause it, like allergy medications or blood pressure medications. But if it's typically only occurring at night, then most of the time it's going to be either from dehydration, it can be from mouth breathing, or it could be from excessive caffeine or alcohol that you're drinking at night. So when those things occur, once you get those checked out, rule out the bad things, and then if, in fact, it is from mouth breathing, get your snoring checked. And if that's all it is, there's ways to treat that, simple, non-surgical, and just try sleeping on your side or on your stomach rather than on your back.
Good place to start.
Yeah.
Okay. Our final question for you today is sort of a cosmetic one, but I'm sure this could be painful as well. How do you get rid of ugly and annoying corns on your feet? Is surgery required? Yeah,
not a real popular topic, but very popular as far as how often it occurs.
Sure.
And corns really are just from pressure on the skin on the foot. And the difference between a corn and a callus is that they're usually smaller, they're harder, which means that they cause more pain, and they're not on weight-bearing surfaces. They occur on the side of the foot, not on the sole or on the heel. And typically that's from tight shoes. It can be from bunions or hammer toes or irregular-shaped toes, or from bearing weight on your foot abnormally based on, say, an abnormal gait. The way you treat it is obviously pretty simple. Looser fitting shoes, you can use pads. There are ways to file down the corn itself, and then there's also topical acids that can be used. Now please beware, if you are diabetic or if you have peripheral vascular disease, poor circulation, don't try to do that yourself because it can cause complications, infection, and then of course all the problems that can arise from that.
All right, best to get it checked out in that case.
Without question, yes.
Okay, all right, Dr. Soria, thank you so much.
You're welcome.
If you've got a question for the good doctor, you can always send it to him by going to our website, WPTV.com. Just click on the health link once you get there. You can scroll down, and right on the right-hand side, you'll see the form there to send him